We divided the evacuations into phases. Phase 1 was successfully executed on the 23rd of May when we received 230 or so returnees from Kuwait. The Phase 2 evacuations, which mainly comprise privately arranged charter flights, as well as evacuations earmarked from now to the end of 2020, is as follows. 2 evacuations from Nigeria on the 4th and the 11th of June the 4th brought in 7 persons, Ghanaians, and on the 11th, we received 70 returnees who, as we speak, are undergoing their 14-day mandatory quarantine. Then we had an evacuation on the 6th of June from Washington, D.C. of 41 students who were on exchange program in the United States. The evacuation was financed by the State Department of the United States of America, and they are also under quarantine. We have also received on the 6th and the 9th of June a total of 19 Ghanaian mine workers, and they are also in a hotel under quarantine. 14 Ghanaian mine workers were also evacuated from Burkina Faso on the 6th of June. They are also in quarantine. On the 8th, 24 Ghanaian deportees and 1 student were received from China and are undergoing quarantine as well. Then we have 45 workers from Israel who were also received on the 12th of June, also under quarantine. The ministry took advantage of charter flights arranged by the governments of Egypt and South Africa to evacuate their stranded nationals in Ghana. So the South African government, the Egyptian government were bringing in flights to evacuate their nationals out of Ghana. And we were able to, for South Africa, we brought in 3 Ghanaians, and for Egypt we brought in 3 Ghanaians. For South Africa, we brought back 5 Ghanaians. They are also going through the process. All these evacuations have been successfully executed. The 3rd phase of the evacuation exercise began on the 12th of June with the arrival of the first batch of 254 stranded Ghanaians from Dubai. In addition, 141 students who completed their French language proficiency course in Benin Republic were evacuated on Saturday, 13th June by STC bus. They came by STC buses and are undergoing the 14-day mandatory quarantine. We expect to receive the second batch of 250 stranded Ghanaians from the UAE today, the 16th of June. And then the following assisted evacuations are also in the pipeline. Tomorrow, the 17th, and Sunday, the 21st. We have over 400 Ghanaians who will be coming back home. Also on the 19th, we are expecting 13 Ghanaians from Burkina Faso. They will come by road. And then we are looking at also bringing back Ghanaians totaling about 195 from Lebanon on the 19th, like I said. Then we'll be evacuating Ghanaians from New York, from Washington, D.C., from China, Guangzhou. And China, we are looking at the end of the month, as well as end of the month for Washington, D.C., and also for New York. We are also planning evacuations, and we are discussing it for the Ghanaians within the continental Europe area. And there are not that many, but discussions have started. Discussions have also started to bring back home Ghanaians in other parts of Africa. Let me conclude by reiterating that the government of Ghana is committed to successfully assisting to bring back our nationals who are stranded outside because of obvious reasons, and will continue to provide updates on evacuations as and when it becomes necessary. Thank you.
You know, I'm the sanitizer prefect.
Yes, it's good.
Yeah. Minister, thank you for the presentation. Colleagues, because the Honorable Minister will have to leave us, I would like to take any questions relating to these assisted travels now so that she can respond to them and take leave of us with her team, and then we'll move to the other parts of our presentation. If there are questions on the assisted travels, please indicate by hand, and I'll invite the first three. TV3 Multimedia Atenka, please step forward. TV3 Multimedia Atenka, you are first takers.
My name is Joseph. I work with journalists. The minister concluded by saying...
Joseph, please hold on. I'm not sure your microphone is active. Is this microphone active? Is it? Please go ahead.
Yeah, the minister concluded by saying that, government is committed to assisting. The cost we keep getting from persons who are outside is that the cost of remaining in isolation when they get into the country is a major headache. I want to find out whether there is any discussion, any plan in place to help them. And the other issue has to do with, you gave a breakdown of the figures. Just if you can give a total number of those who have come in so far. Thank you.
Those who have come in so far?
In so far, yeah,
okay.
Thank you.
Okay, Joseph, thank you for your question.
Yes, thank you very much. We want to find out how many of these people are coming on humanitarian grounds. You talk about the destitute, but you didn't put a figure to it. And then are there plans to look for a much cheaper hotel to keep them, since the cost is still a challenge?
Okay, so I'll add that, or I'll factor that into the first question by Joseph. Yes, sir.
Yeah, from Atinka TV.
We beg you not to be touching the microphone. Sure. Can I get the assistant here so that if you have to adjust, then you adjust. Then colleagues don't need to be touching the microphone. You need to sanitize after that. Go ahead,
With
sir.
regard to what is happening, I want to know the challenges the government is going through bringing them to the country. Just want to know the challenges.
What are the challenges involved in these assisted travels?
Yes.
Okay, thank you very much.
And also the cost involved.
And the cost.
Yes.
The cost to the state.
Yes.
Challenges and cost to the state.
Right.
Okay. Is there a second? Chief, I'll be very happy. Boss, please, come and use this for me. Because you were touching the microphone, I need you to. Is there another batch of questions so the minister will take them all together? Just to recap, what is the cost, or what is the plan to deal with what is appearing to be the high cost of the quarantine to those who are having to pay for themselves? What is the total number of persons who have come in so far? And specifically, can you tell us how many of these fit into the humanitarian category? Are there any challenges with these assisted travels? These are the questions so far. Is there another batch of questions? One. Should I take this to be the final question for the Honorable Minister? Should I take this to be the final question? We'll take it as the final question. Yes, sir.
Yeah, my name is John Aouni. I represent Kesvin. Whilst we were speaking, some Ghanaians are monitoring in Chicago. You did mention New York and then Washington, D.C., the next line of evacuation to be effected. So they want to know, when is Chicago going to have their share? And secondly, they are saying that they have a lot of investment in Ghana, but because of the COVID, a lot of investment has gone in the drain. Whether the stimulus package government initiated, there will be something for those in the diaspora who has investment in Ghana. Thank you.
Just to get some clarity, as in whether government will give individuals money.
Not necessarily money, but their investment that has been affected by the COVID. Whether there's some stimulus package to make their business soar or to make their business be in existence in Ghana.
So let me deal with that as part of the general stimulus question. The category for beneficiaries of the stimulus, whether you are local or living abroad, I think has been explained. So it is whether or not you fit within that category that you would apply. It's not about diaspora or locals. There's a category for the stimulus. There's a first 600 plus 400, making 1 billion for small businesses. There's about 3 billion that goes to the next category of businesses. And the finance minister is working on the recovery and resilience plan for the broader economy. So depending on where you fit, that's where you go. It's not about diaspora or local. But I'll invite Honorable Minister to respond to the other questions. Just to recap, are we doing anything about the cost of quarantine? What is the total number of persons who have come in so far? And out of that, can we give a specific number for those who fit into what we call the humanitarian bracket? Generally, can you mention some of the challenges with these assisted travels and maybe even the cost of the assisted travels to the state? And then finally, what about people in Chicago? And Minister, permit me to broaden that question. In the various countries, you are probably evacuating from one city. What happens to people who are in other cities in that same country? Do we have plans to go to the various cities, or do we want them to come to these central evacuation points? So even beyond Chicago, I think we can give a general answer. Honorable Minister.
Thank you very much. So far, 856 Ghanaians have been assisted to come back home. Cost of hotels, the high cost of hotels. This for us also is a major problem. And when I say us, I mean the task force. Like I said, there are several ministries, departments and agencies working together. It is difficult for the task force to get hotels that are willing for their hotels to be used as for quarantine. That is a major problem. And so the hotels that have agreed are the ones that are being used. Also, the second issue that we have is, even if a small hotel agrees to be part of this, the problem would be that our hotels are small. The small hotels are very small hotels. So you probably would have a hotel with 10 rooms, a guest house with 5 rooms, and the logistics to try and, first of all, make sure that the health authorities visit them as they normally would, will be a problem. Also, the security services would have to be posted at these quarantine centers or these hotels. That would also be a problem. So we're always looking for larger hotels that would be able to cater for large numbers to make it easier for us. So those are the two main issues why we're not able to get hotels, smaller hotels, to be part of this, apart from the fact that they also do not want their places to be used. And I'm sure we all know what kind of stigmatization we're having to deal with because of COVID. So these are the issues. So we're trying to find ways of cutting down the hotel cost. It's quite substantial, 600, 650, 500 Ghana cedis a day. However, that includes 3 square meals a day plus water. But if you times it or multiply it by 14 days, then you're getting, for 500, you're getting about 7,000 or so. And for somebody who is stranded, might be a bit problematic because they've used up all their monies. But we're looking at ways in which we can give them some small respite. The challenges that we're facing, I've said it already: finding hotels that want to participate, the cost of the hotels, who do we categorize as destitute? And the typical example that I gave was there are people who are in Dubai who, well, part of them have been brought back. The other group are on their way as we speak. There are people who were found loitering about, who, because of the circumstances of how they live in such places, countries like Dubai, where many of them are artisans, are maid servants, domestic workers and stuff. They live in dormitories, and they work in hotels as well. Once your employer loses their job, they kick you out. Hotels have closed in those countries, they've kicked them out. So they were living rough on the streets. And so these are people who are destitute, and they made headlines in Dubai newspapers. So we had to bring them back. So those are some of the people that we would categorize as destitute, and we've had to bring them back. We're looking at doing central points from every country in terms of the evacuations. And it will be difficult for us to go from state to state and organize people to bring them back, which is why we're doing New York and Washington, D.C. In any case, these are the two places where you have direct flights from Ghana. And so it's easier for us to do that. Usually, those who live in other parts of America would do the internal flights to New York or Washington, D.C., and then catch their direct flights to Ghana. So that's exactly what we are doing. If anybody, and many of Ghanaians who want to come back home have contacted our embassies, and they're not New Yorkers, the resident in New York or in D.C. only. They are coming from all parts of America. It's the same for Europe. It would be easy. And if there are any Ghanaians in other parts of Germany, Germany is quite a big country, they come and connect their flight from Berlin to Accra. So that goes for other places. China, the same. We're doing from Guangzhou. That's where the majority of Ghanaians are. So I believe I'm done. Mr. Minister, I think I'm done.
Minister, I'm grateful. Just as you were speaking, there were some of the comments coming in suggesting that for those who may have smaller facilities and they want to offer them, would we be open in engaging them?
Yes, it depends on how small. But if you have a hotel or a guest house that has 4 rooms or 6 rooms, that would be difficult because, like I said, we're trying as much as possible to have numbers in one place so that the logistics connected with the health care that they need and the testing and all of that can be done easily. And of course, also to do with the security services doing their work. So yes, if it's a hotel of about 50 rooms, we will consider. We will definitely consider, but not in the small numbers.
Honorable Minister and your team, we are very grateful that, like they say in Parliament, you have attended upon our invitation this morning. Thank you very much. We do understand that you have some engagements this morning, and we grant you leave to attend to those engagements. I want to call on Dr. Patrick Abuaje and the Ghana Health Service team for a quick update on our case count and case management situation as is available to them currently. And then while you are at that, I would like you to kick off the conversation. I would invite Dr. Nsiasari to comment on the back of it, but I'd like you to kick off the conversation or to kick off the official Ghana Health Service response to the concerns by some that you may be massaging or suppressing some of the numbers. I've seen a statement from one of the respected groups in this country, Occupy Ghana, which is raising some questions. And we think it's important that you respond to it. The numbers are as put out by you, Ghana Health Service. So you are the first persons that we think should be responding. And the claim is that you are not telling all of us the numbers as you have them. So please come up, you make your first comments, and then later what we have to say on the back of it, we will.
Good morning, Honorable Ministers, UNICEF Rep, colleagues, Presidential Advisor on Health. Maybe, Honorable Minister, I'll go on with the updates and then go a summary of how we look at these things. The numbers, as we've already said, we have a system of testing and collating the numbers, and that's how we collate. So I'll give you a brief update, and I'll talk about broadly how some of these things are gathered. I'll start with the global situation. So far, as of the 15th of June, the world has recorded about 7.8 million cases, with a total of 431,000 deaths at a death rate of 5.5%. Africa still remains the continent with the lowest number of cases, recording about 175,000 plus with confirmed cases, and with the lowest number of deaths at 4,111 at a rate of 2.34%. If you look at the next slide, you will also notice that what I've said is just as it shows. You can see by the regions that Africa and the Western Pacific has the lowest number of cases so far. As at yesterday, the report we have in the total number of positives are 12,193 cases out of 255,971 persons tested at a positivity rate of 4.76%. Like I said, these numbers are the numbers that are from the very first day that we had a case up to today, and we continue to add any numbers that are tested. And our policy is routine testing, which is those who report with conditions. And then we also have enhanced testing, where we are testing our contacts and also identifying at-risk groups to test them. We have 4,326 recoveries so far, but we maybe, because there's new evidence about the behavior of the virus, and so we may be reviewing, looking at all that events to look at our discharge policy, so that we'll be able to get more people of who really do not need our attention no more. We have recorded so far, declared 58 deaths. The last 4 deaths which was added are all in Greater Accra, 3 males and a female. I'll give you the details when I get to the next slide. So that leaves our active cases to about 7,813. Currently, there are 13 severe cases, with 4 on who are critical and ventilators. Now, as of today, the new addition is 229 new cases from 9 regions, 9 out of the 16 regions. Ashanti region has recorded 70 new cases, Central region 42, Savannah 34, Greater Accra 32, Western region 17 cases, Eastern 11 cases, Volta 11, and Upper West 10 cases, NOT 2 cases. And these are, when it comes to Greater Accra, of the 32, we have a generalized spread. We are not having major hotspots, and so we have Weja, Ayawa. So these are the regular places where we have routine, regular cases appearing. Eastern region has 11 new cases from Brim North, New Jabin 1, and Fantiakwa 1. So that's quite, as you can see, the outbreaks, the initial spurt in the Nkoko area, Ko West, has been contained, and so there are no more reporting cases. Central region is reporting 42 new cases from Gomwa and other parts of the country, but they are more spread, minor 221 here, that has been coming up. Western region had 17 new cases. We are from the same Takwa and Suayem and Sekeni Takwa. These are the core hotspots. As we speak to now, the public health team, Dr. Sarkodie and his team, are in Takwa. They're trying to work with them in isolation and finding adequate isolation and being able to contain and move all those who are positive into a place to contain the spread. Upper West recorded 10 cases from Sisala West, and these are follow-up of contacts from a case that was identified. We have Walter having 11 cases. Ashanti reported 70 cases, again from Ofori Krom and Kumasi Metro. These are the core areas, so you can see that the generalized by the number of districts that are reporting cases in Ashanti in the last a week ago has significantly come down. Upper East, Northern, and Northeast did not report any case. So, as you can see, the Upper East containment has also been done because that was in one small location for which we were able to quickly contain, isolate, and then we are not getting new spread again. We have the Western North reporting no case. We have Savannah reporting 34 new cases. These are from enhanced contact tracing in two race groups. Areas where we have a lot of mix of people coming from other parts. And so they identified a risk group. So once we go in there, we contain, and then this cut spread from that community into the rest of the community. And that's why you're seeing the new 34 there. So we're going to deal with that one. So that brings a total of 229 cases, and that's the daily count for the period. If you go to the next slide, you see that we still have so many of our districts are not generally affected. We have some districts that are, so that's how the pattern of our spread remains the same. Greater Accra, as you can see, is concentrated within the beach area, the Accra metros, and these contiguous areas. Most of the districts that goes from Pram up are still quiet, and those Gan East, Gan North, and Gan West are still quite close. So you can see that it's quite a circumscribed area where a lot of effort is being concentrated in. We have the similar pattern in Ashanti where there are some districts without any case, but we still have some cases of Obuasi, Kumasi having some intense spread. Okay, I mentioned that there were deaths. These deaths, we added 4 more deaths, and I'm just going to show you the procedure. Once a death is reported in a region, we have a national case management team that does audit, clinical conferencing with them to see what was the cause of death, how was it managed, is it all the circumstances, is it a COVID death, how do we confirm? As soon as that is done, they are added. And so you may see a region reporting a certain number, but we are not only interested in the number. We want to know whether is treatment appropriate, where are they coming from, do we have the things you need to. So that's how it is being done. So just to say that nobody is deliberately holding numbers. We know the state reps are there, and every Ghanaian will see what situation reports Greater Accra, Ashanti, all regions will provide. But there is a process, because we are only interested in just the numbers, but also validating and knowing what to do. And that's why the whole of last week, the case management goes out there to see what is happening in the region. Do we need additional beds? Do we have enough training to manage those cases? So those are the things that we do. So as and when the case management team has a conference with the region, they will clear and the numbers will go up and be handed to us in part of our report. Yes. Currently, because of easing restrictions, a lot of activities are going on. We are continuing engagement with our stakeholders to see how we can improve the protocols for management. We will continue our crisis communication activities and to support the enforcement of preventive protocols at tertiary. In collaboration with others, as we are aware of, we supplied about 600,000 face masks to these schools, ensuring that every child has and staff can have 3. We have 1,700 Veronica buckets to allow for hand washing where there's no running water. We have sent 200,000 liters of hand sanitizers to ensure that this triad of hand washing and social distancing are all maintained, including thermometer guns, to ensure that those who need to have their temperature checked are checked and isolated. Facilities also have are asked to create holding rooms, isolation rooms, and then there's a team, the health sector has been mapped up with these facilities to be able to provide the necessary responses should there be any outbreak or any suspected case. Mr. Minister, this is what I have for you. Thank you very much.
Thank you, Dr. Abuaji. I want to invite Dr. Nsiasari to make some remarks at the policy level and at the decision-making level. I want you to also give us a quick remark on this thing about worries that maybe some numbers are being suppressed or massaged. Do you generate any numbers at the policy level? How does that correlate with what the Ghana Health Service is telling us? So please step forward for your remarks. And then I'll take questions on this bit, and then we'll move to gender. The microphone especially. That's in the tip of the mic.
Thank you very much, Mr. Minister. As the Director General of Ghana Health Service said, at the policy level, we all get the figures as you are getting this morning. So we don't generate any figures from the policy level. The Presidential Task Force, and that matter for the presidency, doesn't generate any figures. There is an implementing agency. So this COVID-19 fight is led by Ghana Health Service, the teaching hospitals, and the Ministry of Health is the policy level who is also organizing them. And then we have a Presidential Task Force. The presidency doesn't generate any figures. We see the figures as you have seen here today, and then we then use the figures to plan and monitor whatever is going on. We have shown you exactly the regions and the districts where where we're having the COVID-19 cases. So we then target the regions and the districts where we have to send resources there. So I want to repeat once again, we don't generate any figures. We don't manipulate any figures at the presidency or, for that matter, at the Presidential Task Force level. And that is how it is. So I want everybody to take it that the figures that you see, that's what we put forward. And when they put the figures forward, we take it, plan of it, monitor, and then supervise whatever is going on in the country. Thank you.
Dr. Nsiasari is the presidential advisor on health. He's a member of the Presidential Task Force, just giving us a quick comment and perspective. Colleagues, if there are questions to the Ghana Health Service and on health policy matters, I'll take them now, and then I'll move to part 3 of our brief today. The usual suspects. Joseph, please step forward. This is a Searchlight newspaper, right?
Yes.
Yes, sir. So please, let's spread out a little bit. Let me take the first 4. Let's spread out a little bit. 1 meter apart. You know when we're in primary school, when you go to assembly, you stretch your hand. Okay, sir.
Yes, Joseph Akable here join you, sir. My question is, the Director General said that we have learned something about how the virus behaves, adding that we'll take a look at our discharge policy. I want him to explain that further, because I recall that some time ago he did say that they were considering changing what we will describe as recovery in terms of the double negative, whether that is what he's referring to. And the second issue is, the last time I asked about the available bed capacity for treatment, the figure he gave was around 600. I want to find out whether we currently have enough spaces for treatment in terms of people who want to be kept and treated in government-managed facilities. Thank you.
Thank you. So 2 questions. When you say possible review of our discharge policy, are you talking about the double negatives? And then what is the status on the capacity to manage persons who are physically sick? Has it gone beyond the 600 that you are reported to have mentioned earlier? Joseph, did I get your questions right? Thank you. Yes, sir.
Yeah, good morning, sir, Honorable Minister. I have a problem and an observation that I want to make. I don't know, there's a legal backing for asking people to follow the protocols, especially wearing a face mask. Those of us who take public transport, it's a very worrisome situation. The drivers, the mates don't observe at all. Some passengers don't even observe. They say that this disease is not anything serious because people are not dying, and that's a form of fever. I don't know. So we don't want to get to a point where some countries, hospitals are overwhelmed, and the financial muscle is not there to take care of these people. So what can government do? It might be, I don't know whether they're going to enact a law.
The president has announced already that it is now backed by law, it is mandatory, and he has asked the security agencies to proceed to enforce. I'm sure you all heard that in his address.
And yes, people are still not observing.
So he has asked that the security agencies go out there and enforce. So your question is there a law?
Yeah, to back the
It is now mandatory,
Yes.
and the security agencies are being asked to enforce.
Okay, so, okay. That's what I wanted to find out.
Okay. So it is now mandatory, and the security agencies are being asked to enforce.
Okay.
Yes, sir.
Good morning, Honorable.
Yes, sir.
FM Opoku, me free Kingdom FM.
Yeah, Opoku.
The question, Papa Ebu said,
Okay.
second one, yeah. Me say, Ministry of Health, the students, no, among students, as at May 15th, and I try to know. Almost say, for ministry, they say, this is September, Sunday, be employee or more, any or more feeling now. So, basically, say, as at 15th May, registration until September.
Okay, right. I'll go to Dr. Abaji.
Okay.
Take note of it. Yes, sir.
Thank you. So the National Blood Service says that it is prepared to be used on those who are critically ill as far as COVID-19 is concerned. I want to find out if the Ghana Health Service is collaborating with them on this one. Beyond that, also yesterday I was trying to find out if as of now we know our daily infection rate. If as of now we're able to tell.
But this one yesterday we explained to you that it is already on the website itself.
I checked the website. It talks about new cases. I didn't see daily infection rate.
Is it not on the website? The daily infection rate isn't on the website.
No. It's not there.
Team, can you please load it up so that if we are missing it, then we take it as feedback and quickly fix it. Is there another batch of questions? EIB. Yes, sir. Please step forward. Apart from EIB, is there any other question? Apart from EIB, is there any other question? Chief, you have a question? Okay. All right. So I'll take these two as the final questions. EIB, please take the first shot.
Okay, so my name is Eric. I work with Star FM. The concerns raised about the contact tracing team and the allowances being cut. Yesterday, I recall you mentioning that the presidential task force was going to meet. Can we get an update as to the concerns that are being raised? And also in relation to that, there are some concerns that with all the things that have been happening, we failed in tracing some of the contacts of these individuals who have tested positive in recent cases. Is that the case? And is there a plan to mop up on these contacts that have not been traced? Now, the Director General mentioned a new trend of the disease. A new trend of a sort of the disease which they are going to study. Akable asked about that.
A new trend of the disease which we are going to study?
A new behavior of the disease. And so I want to find out if that is the reason we are seeing the increased cases in the past few weeks, because I think in about a week we've seen...
Please let me see if I understand this. Are we saying that we want to study and determine whether the behavior of the virus has changed? Or we are saying that there's a change in the behavior that we want to study?
New evidence.
That what?
New evidence on the behavior of the spread. And I'm asking if that is what is causing the increase we're seeing.
Okay, I'll let you clarify that.
And then
yes,
lastly, there are concerns about a lack of reagents for these testing sites, and it's resulting in samples being packed and not being tested for.
There are reports that the labs are short of reagents, and that's delaying some of the tests. We'll need you to react to that one.
Yes.
Okay, yes, sir.
Yes, Dr. Baji, people are saying that those who die from the disease, they want to see physical evidence. Because they are saying that it's a hoax. Seriously, because I've done a lot of interviews with other people, and they're saying that it's not there. Because we all hear that AMA, Health, whatever, has buried 3 people, 4 people here and there. They want to see it with naked eyes on television pictures, so that it may put evidence and then put some fear of God in them. And
so what's the question?
So I want to know whether it is not possible to show this on the television for us to see.
Okay, thank you for your question.
And then
sir.
my second question, has any vaccine been found so far for the cure of the disease? Because I hear some rumors saying that some countries have developed the vaccine, and I don't know how true it is. Thank you.
Thank you. Very quickly, I think I saw on television, is it Joy News or so, that did a full report following some of the persons who had died and were being buried, and the teams that were doing the burials, talking about the number of burials that they had done, and etc., etc. So, Chief, even though they can't show physical dead bodies, I think all of that record is available. The families of deceased persons, I think if I followed some of them, I've also been speaking. So I'm sure you can highlight that for us in your reportage. Dr. Baji, please step up with answers. And also specifically, the reports that some contact tracers have laid down their tools or are not being paid their money, which the Presidential Task Force asked the Ghana Health Service to validate and report on. You can share with us your updates as you have it now. Please come forward.
Thank you very much, Honorable Minister. Okay, I'll start with the discharge. What we are talking about is not about the recovery. The recovery is more like a viral recovery, which is still the two negatives. What we are talking about is reviewing evidence on discharges. There's evidence. The WHO has come up with 3 protocols. The first one was in March, there was the second one in April, and the last one, which was on the 27th of May. We are talking about the shedding of the, so if I'm positive, how long does it take me to spread? So they are saying it takes about maximum by 11th day, you are no more shedding the virus. And so if I'm not shedding the virus, should I be in isolation? We are no more a threat. And so we don't have to wait for 2 negatives before such a person is discharged. If the person is sick and recovers, they are recommending that if you have 3 more days of no complaints, the person can be discharged from COVID. But if you are there with your hypertension, you can continue managing your hypertension. So these are the things that we are looking at, ensuring that there are many people at home who have been there for weeks. Are they still an issue? They are not. So so there's the difference between discharge and then the full recovery, and that's what we're talking about. But we are still looking at the study, the evidence. We'll look at it again. All our directors have met. We have some position on it, and then once we get to become policy, it will be announced. The contact tracers. Okay, let me start with the nurses. They closed the portal on the 15th. And I know that from Monday, so many regions are starting their recruitment. Ghana Health Service has been giving their quota. The regions are starting their interviews and posting. So I don't know where this September is coming from. I know regions that are going to start their interviews, and some of them have been told when to come for the interviews, and so I don't think that is true. We also are talking about, I think there was the issue of the delay, the contact traces. When we started the lockdown, we recruited 1,000 volunteers who are not our staff to do contact tracing, because we wanted to ensure that the health sector is still buoyant enough to receive any cases that come in. So we didn't want to use our own contact tracers. Prior to that, we were using our own contact tracers. It was for 3 weeks, and those were the ones who were paying the amount of money. After the lockdown, we reverted back to using our own contact tracers. Some 2 districts, one in Ashanti and one in Accra, continuously use them, and that's where there are issues that we are trying to resolve. But currently, contact tracing is ongoing. In the 14 other regions, they have not used volunteers. In Greater Accra, now they are in Ashanti, they are using our own staff to do contact tracing. So contact tracing is going on. That is why we continue to report cases. If you are not doing contact tracing, we're not finding any case. Otherwise, we'll be waiting for people who are sick to come and test them. So that thing is not true. But you see, we are also doing risk assessment. That's why we're doing the enhanced contact tracing. We go some risk groups, we go and assess them. Certain categories are done, and those are all ones done by contractors. Once you have a positive, your contacts are listed, and the team goes. When we have a surge in a particular district, we collect, we get data, contact tracer from the neighboring district to come in and assist if there is a surge. So we really have not had any reduction in our contact tracing effort. The labs are working. There were had a few challenge with some pipettes, but it's all been replenished, and the labs are all going on currently. Somebody wants to see devs on TV. I think the minister mentioned that already. We've seen relatives speak. I'm sure there's somebody who lives in a town who have seen someone die from COVID. Ethically, we cannot just go and show you faces of people. And when you see on CNN, they don't show you anybody's face. You see, maybe we can look at something like that, but I don't see how that is possible. People must believe that people die and then from COVID, and the whole world is not lying. And so Ghana may not be so different from that. Currently, I know that there are about 100 teams working on vaccine. I do not have any information that any vaccine has yet been released. The daily infection rates, I think we'll put them on the website if it's not there.
We have actually loaded the website, so
yes.
We will not refer to it. Just explain to us what the new cases mean. I think that's the question.
Yes.
Right.
So,
yes, and we have been.
Do you want to look it per as a risk or per million population or per what?
The nominal, the daily infection.
Oh, okay. All right. Okay. I think it's if you go into the all updates, the chart I showed you, where the new cases per region and which district they are coming from are all there. We are trying to review and make sure that those bullets are also put the daily cases there, the numbers on admission. We are going to update all those things. But as far as if you go to the, apart from the dashboard, but if you go to the all updates, if you look down there, you see what I presented in full chart with trends and everything there. That anybody who wants further information can to that. This is the dashboard, but the new cases, like I said, 229 today is there. We had a number for the day before and the other day. Even we didn't present the presentation for the 12th because it was too close to publish. If you go there, the report for the 12th is there, 11th and 13th is there. So you'll be able to see, since we started daily reporting, every case that has been filmed. We work together with the blood services to look.
Thank you. Doc, I think we all need some clarification here. On your website, you mentioned new cases.
Yes.
We want to understand what you mean when you say new cases. There's also a certain concept that we see floating about, what they call the daily infection rate. Does your new cases mean daily infection rate? Or is it that is calculated differently from the new cases as are published on your website?
No, I think the daily infection rate is calculated differently. What we are having, it may not be too useful, but normally we can do a certain period and then look at where it is happening. But if you want to do it daily, it really will not be helpful. We have models that are showing that your R naught etc. that we have, but that is, I keep saying, that is more for planning and risk assessment. So, but if you go into the all updates, as journalists, I think we need more information. After this, go into the all updates. Look at today's update, and the full details are there. The total number of cases for yesterday was 229. We have number by region, numbers who do not present. And in the region, it will tell you which districts presented a number. That will add up to your, let's say, the 34 in Savannah, which is from East Gonja, East Gonja, and Bupe area. So these details are there for you to see what is happening. In terms of the plasma, yes, it's a new technology. As you heard yesterday, it's only yesterday that FDA after going through the process, gave the approval. And so we all worked together to make it happen. And so we are now ready to be able to use the plasma for critically ill. This has been done in other countries. We are now going through our procedures and it's available for use. Honourable Minister, I think I've probably covered all the questions. Thanks.
Dr. Abuaje, thank you for the health part of our presentations. Thank you, Dr. Nsiansari. We'll move to the third part of our presentation. As I mentioned, today is the African Union Day of the African Child. The minister responsible for gender and social protection and her team are here to give us remarks on a number of things. I want to ask Florence, who is the director of the Department on Children, to join me. But first, I want to ask you to please pay attention to the screens for this video, and after that, Florence will lead us through the remarks that we are to receive. Thank you.
Speaker of the National Children's Parliament, Ghana. Speech by the Speaker of the National Children's Parliament, Ghana, on the celebration of the AU Day of the African Child. Honorable Minister for Gender, Children and Social Protection, distinguished invited guests, friends of the media, all protocols duly observed. I am Nurian Letitia, a pupil from Wa Methodist School for the Blind, and also the current Speaker of the National Children's Parliament, Ghana. I bring you fraternity greetings on behalf of children of Ghana on this year's celebration of the African Union Day celebration of the African Child, which also marks the 30 years anniversary of the African Charter on the rights and welfare of the child. Access to justice is essential for the protection of the rights of children from discrimination, abuse, violence, and exploitation, and for ensuring the best interest of the child is paramount when it comes to all actions and decisions that involve or have an impact in the life of the child. Without effective access to justice, children remain vulnerable to abuse from the family, environment, and the society at large. Unfortunately for us as children, the global COVID-19 pandemic is negatively affecting the welfare of children as most schools have been closed, coupled with the slow economic activities as a result of restrictions imposed by governments worldwide. I will, on behalf of the National Children's Parliament, Ghana, appeal to all key stakeholders and duty bearers to support children attain their full potential by putting in place policies, strategies, and projects aimed at ensuring their rights and responsibilities of all children are fulfilled and protected during these challenging times. I will also like to conclude my speech with a passionate appeal to the general public, especially children, with special emphasis on girls to adhere strictly to the COVID-19 preventive protocols, that is, washing your hands regularly with soap and the running water, Practice social distancing, into bracket being 2 meters apart from each other. Use alcohol-based hand sanitizer, and most importantly, pray to God in our collective fight against the deadly COVID-19 pandemic. Happy African Union Day celebration of the African child, and may God bless us all. Thank you.
Thank you. Ladies and gentlemen, that brings us to the beginning of the second session of today's briefing. And as the Honorable Minister said, we are celebrating the 30th anniversary of the African Charter on the Right and Welfare of the Child. And it also marks the 16th June every year is used to mark the African Union Day of the Child. And this year, we are celebrating it under the theme, Access to Child-Friendly Justice System in Ghana. And as the Speaker of the Children Parliament said, access to justice is critical to ensure that the rights of children are met at all times, and to ensure that we understand ourselves in this COVID era, and for us all to know that even as we pray for justice for children, COVID-19 is around, and there's a need for us to be aware of how the disease is affecting children and how we can also act to protect children. So without wasting much time, I would like to invite Mother A.C. Amwafo of the Family Health Division of the Ghana Health Service to give us a brief presentation on the COVID-19 children's perspective. Thank you very much.
Honorable Ministers, Presidential Advisor on Health, the Director General of the Ghana Health Service, UNICEF representative, directors, colleagues, distinguished members of the press, ladies and gentlemen, good morning. My name is A.C. Foruwa Amwafo, and I'm doing this presentation on behalf of the Ghana Health Service. And I'd like to start by acknowledging the input that we have received from UNICEF and WHO. As most of you may be aware, on the surface, it might look like children are not severely affected by this pandemic. And indeed, if you take a closer look, you will see that children have been largely spared by the severe presentation of the condition. And they look, I'm expecting my slide to be loaded. Okay, I'll continue. We've taken a quick look at the data and an analysis of, thank you very much. So as you can see on the slide, we looked at 4,000 cases that we disaggregated by age, and indications are about 332 are children aged below 18 years. And interestingly, even though when you look at the general populace, there are more men who are affected by the condition, but then a look at the children shows a different pattern, where we see that 55% are female compared to the males. Today in Ghana, the youngest child confirmed with the COVID condition is a 27-year-old girl and then a 50-year-old boy. Both came from Ashanti region. When you look at death, we have 2 cases that are recorded to have been death of children. One, a 9-year-old boy with no documented comorbidity, and a 10-year-old girl with retroviral infection, pulmonary tuberculosis, and anemia. On the surface, we may think that these are small figures, but it is important to note that it is much more common for children to tragically lose parents, family members, a caregiver to COVID-19. And the psychosocial impact of these on children should not by any means be underestimated, because it has repercussions for everything else in their lives. Now let's look at the indirect impact of COVID on children. Today, as we are all aware, mitigation measures implemented to control the pandemic, such as school closures and containment at home, are also impacting health and well-being of our children. Indeed, essential child health services have been impacted. Both the provision and utilization of these services are beginning to show downward trend. This we have estimated may be due to the fact that sometimes the limited number of our staff will have to be redeployed to provide other services. And in some instances where a health worker or a team of health workers are infected, then they are not available to provide services. And more, as the health services become overwhelmed in caring for large numbers of infected patients requiring treatment, we see that children especially, but also pregnant women, are not having access to essential services that are needed for their care. Now I have a list of specific impacts that we can think about today for several reasons that most of us are aware of. Face-to-face child services have been partially or completed suspended. This includes nutrition programs to improve breastfeeding and diet of children. And you can imagine the effect that eventually will have on their nutritional status and general growth. Maternal and newborn care somehow has also been affected one way or the other. Children are not having access to essential immunization services. Sexual and reproductive health services are also compromised. HIV treatment, community-based health, social protection programs, among other essential services that are compromised or suspended for several reasons. It is also becoming clear that reduced household income may force poor families to cut back on essential household inputs, including food, and we all are aware what that means for the growing child. And when it comes to uptake of our services, the somewhat wrong perception of some parents that it may be risky to go to our facilities today because they fear that there is the place that they are likely to get infection is also affecting uptake of our services, and ultimately will have consequences for the health of our children. Now the negative social consequences. Again, the mitigation actions like school closures have had limited access to, it means children have had limited access to learning and academic progression, putting especially those in rural areas at a disadvantage. Today we hear about a lot of children doing their assignment and homework electronically. And the question we should be asking ourselves, that when you go to my rural village and far away corners of the country, are all children having access to learning facilities and other support systems? I believe the answer is no. This is also brought into sharp focus issue of equity. So those living with disabilities, the marginalized, the vulnerable, the poorest, those in rural areas, and underserved communities are most likely to be the hardest hit. This also includes the issue of justice. And I think that our speaker put it beautifully, and I will leave it there. As schools remain closed and cause girls to drop out, we should also anticipate an increase in teenage pregnancy in the year ahead. And we all know the consequences of teenage pregnancy on health and development. It is estimated that there is also an increased risk of the virus on the response that will pose to a long-term effort to achieve the Sustainable Development Goals. You know, we have very good reasons for having put together an agenda for the Sustainable Development Goals. And with everything that is happening, there is the disruption of the agenda to adequately care for children, reduce hunger, malnutrition, childhood illness and death as the crisis evolves. It is also expected that water, sanitation, hygiene services are also at risk of disruption. And this poses great danger and has consequences for diarrhea diseases. But if one considers that water is also critical in the prevention of the spread and containment of COVID, then that puts our children even at a greater risk. A bit on the social consequences. Children's mental health has also been seen to be affected. Anxiety about the negative impact of the pandemic on their lives and communities. The question that nobody can answer about how long these extraordinary circumstances, the fact that they cannot play with their children, even in their neighborhood, not to talk about their classmates, prolongs, will endure, and how the pandemic will ultimately be resolved. These are questions even adults don't have answers to, and children are grappling with that, and it has untold effect on their mental states. For children facing extreme deprivation, acute stress, which can impair their cognitive development and trigger a long-term mental health challenges that can affect all other aspects of a child's growth and development.